Hello, everybody. I'm hoping that there are some people left. We've had some technical difficulties, and being the computer geek that I am, kind of had a workaround. For some reason, the phone just doesn't work in portrait or in landscape mode, so I had to shift it to portrait mode. So I hope you're able to tune in. We're going to wait for a few minutes just to get folks in and comfy. Hopefully, you are at home and safe and doing good. Mary's here helping me. She's right there.
Hi.
There's Mary. And she's going to field questions later on. The way we're going to do it is I'm going to go through state of the city, just kind of talk about what's going on with the COVID, and go through a lot of things, hopefully answer a lot of questions. I'm going to answer questions people have already submitted to me, and I've already talked to them and answered them, but I want to give it to everybody so everybody knows. And we'll go through all those. Then when we're all done at the end, probably 40 minutes, 30 minutes, then we'll allow questions and try and answer the questions as they come up. And Mary will be fielding those for me so that I can answer those. But there's a lot going on. I know it's been stressful times for everybody. We're all in this together. It's a tough situation. One of the things that we're going to do on this is we're recording it with a video camera so that I can post on YouTube, and it will have the closed captioning on there, because I know some of our hearing impaired friends can't tell what I'm saying, and Facebook does not have closed captioning. So we'll be doing that later on too. So how are we doing on people? We got 20?
There's 20 people there.
About 20 people?
I don't know if they can hear us.
Can you send a message if you can hear us and the video's okay? Just kind of let us know we're doing okay and you can hear us. Anybody hear us out there?
Not sure if they can or not. I can't hear it on the iPad.
It says we can hear.
Okay.
Thank you. Is that Lauren? Thank you, Lauren.
Oh, see, those aren't coming up on mine.
Yeah, stuff's popping up on my phone and not on hers, so I guess that's because I'm doing the live feed. So, okay, at this point, I'm going to go ahead and just get started, and then we'll go through all of this, and like I said at the very end, we'll answer some questions. You folks can comment along as you like. But first of all, I want to talk a little bit about BS Free MD. And this is the Hindmarshes. They're both doctors here in Lebanon, and they've got a great website that they're creating, and their Facebook page. And we sat and watched that last night, and the information that they're giving is fantastic on the more medical portion of the COVID-19. Today we're going to talk about the city, our living, our daily lives. I'm not going to get into any technical because I am not a doctor. I don't even play one on TV. But we'll go through a lot of different things. But the BS Free, and it's BS FREEMD, you can go like their page, follow their page. It's a great resource. And they're going to put their back videos, I believe, on a YouTube channel so everybody can watch them. And they're very, very informative. And they're a little funny, too. So you might enjoy that, a little bit of humor. As we know, it was about a week and a half ago, maybe about 10 days, we had the stay-at-home order from the governor. There were a lot of regulations, a lot of things that we're supposed to do, not do, and it's really changed our lives. This whole virus pandemic has changed our lives, and I know there's people that don't believe that it's really a pandemic, that we're overreacting, and there's other people that think that we're not doing enough. So it's really difficult to get a balance on this. And as mayor, I've made the decision to try and keep us as far apart as we can and as socially distant as we can, and keep our facilities closed to not attract people. There was even a point where I wanted to put up some lights, Mr. Christmas light guy, and I wanted to put up some lights, and I thought about it, but that's going to be a destination for people to want to come, and I did not want to do that. So all the things that we're doing, it's difficult, I know, but I don't think it's going to last forever. It's going to be some time. We'll get through this, and we'll get through it together. I spoke to Sherry Springer, our state representative, and she feels that the state legislators should be probably convening maybe sometime next week, but she still hasn't had a for sure commitment on that. So we don't know when the legislature is going to meet. And really the key to the legislature meeting would be money, funds allocations, and things like that has come from the federal government that would be doled out to the state. So let me talk a little bit about the city, what's going on. We've got critical services are all operating, our streets, maintenance, water, wastewater plant, they're all working normal. We have our shifts are working, all the dedicated employees. Some employees are working from home. The city public counters are still closed. You can drop off payments or you can electronically pay them. The library and senior center are still closed, but they've also come back on Facebook and they've got some great feeds if you want some activities for the kids, for the seniors. They've got exercise. They have all kinds of really neat stuff on their Facebook page, so that's a great resource for you. Our police, they're working hard. They're under extremely difficult and strange, unprecedented times that we've never been in, and it's very difficult for them to go out to a call and not know if someone's infected and not know if you're going to take that home to your family. So it's very, very difficult for the officers, and the fire's the same way. I'm not talking so much about the fire at the moment because they're their own fire district, but it's the same thing. They're scared to go out to a call and then transmit it to either one of their partners, somebody at the station, or one of their family members. So it's really difficult. Our police department has been doing extra patrol on businesses because we know a lot of businesses are closed, so they've got extra patrol for that. Also, there's been some car break-ins. You've probably heard about those recently. Make sure you lock your car, keep the valuables out of your car, and we're having extra patrol on that. And that's usually happening at night. So if you have security cameras, a good idea to make sure your car's in the security camera, make sure the car's locked, keep all those valuables out. City parks and trails, and I know this is a bit controversial. The governor put out the order to close parks, and we made the decision to close after huge amounts of people were out by a couple of the trailheads, and so much that they were spilling out onto the street as far as parking, and it was a congregation spot. Even though it wasn't intentional, that's just what happened. So that was one of the reasons that we closed the trailheads. Now, if you're walking down with your dog down the street and you decide to hop on a trail, are we going to come arrest you? No, that's not what this is about. It's about congregating. It's about a bunch of people together. It's about keeping social distances. That's what it's about. It's not about trying to arrest you because you're on some trail. We want you to be able to try and get out and get a little sunshine, a little health. Walk up and down the street, walk around the neighborhood. Just stay away from people and keep your social distancing. That's the key thing. The problem is not everybody follows it, and we open up a park and everybody bombards the park and is there, and it just causes a lot of problems because we're finding, and I'll talk a little bit about later, the social distancing really seems to be working. RVs. The RV park is closed for any new RVs. The people that are there are finishing out their term that are staying there, and the dump site is closed because that's the other side of the park on River Park. It's an inconvenience. It's a health issue. We know that, but we put up on our website, on the city website, resources so that you can find where to get your RVs dumped and safely and sanitarily. Community garden. We are not going to open the community garden. It is one of our parks, but we are going to have our community garden supervisor. She's volunteered to actually plant the gardens, and when it's done, give the vegetables and fruits to the people who bought the plots that can't garden right now, and then the extras will be given out to the community in general. So it will be used. The city is going to help fund that, and Cheryl Castine, our master gardener, will be helping out with that project. So it'll be great. Farmers Market, been had a lot of questions about that. The Farmers Market should go on. We're working with them through the Community Development Department and making sure that we don't have any non-food items there. We're making sure that their social distancing will be maintained. I don't know about the location. We might have it at a different location. Especially there was talks of maybe a drive-through, and it would have to be a larger parking lot to be able to do that safely. So those are all things that are being talked about, but it's a concern. The health of our community is a concern. That's why we're doing this in the first place. but having fresh fruits and vegetables, it's a godsend, and it's awesome to be able to just go and grab some fresh vegetables or fruits that are locally grown. So we don't want to miss that. We don't want that to become a problem for people. One of the things I don't know if you know this or not, but if you want to go to our city website, right up at the top is resources, and you click on that. It's got the COVID, whole bunch of information and resources that we've been posting, but it's in a more of a website format, so you can find it a little bit easier. And I don't know if you know this, so this is a little secret, and if you've tuned in, you're going to get the secret. Oh, I see we're up to 107 people. Excellent. Very good. That's half of Lebanon. No, just kidding. So on the website, our new address on the website is now www.lebanonoregon.gov. LebanonOregon.gov. It's a new website that we've been able to get. All cities are able to move to this instead of, like if you emailed me, it was paziz@ci.lebanon.or.us. And that's a really easy address to mess up. So now it's going to be LebanonOregon.gov. And I think that's going to be a great thing. So you can just go to the website, check it out. There's a lot of good information on there. Driving. I've had a lot of questions about driving, and I'll talk about that in a little bit. But basically, the governor said driving to essential services and needs. Going to the market, going to pick up your prescriptions, going to pick up some food. All of those things are great. Going to work if you're an essential worker, those are things that are all approved and you're supposed to be doing. Running over to Grandma Susie's house and getting a cup of flour because you need to bake some bread, that's not a great excuse, and you should not be out. You need to stay home, and you need to stay home as much as you can. If you got to go out, you got to go out, and we understand that. You've got to live your life. The homeless, the Lebanon police have made up some hygiene kits with hand sanitizer, toothbrush, wipes, and a resource list that they're giving out to folks that are either coming into the soup kitchen or people that the police run into on the streets that are homeless or mention that they are. So we're giving out these resources and help, also referring them to the soup kitchen and the other places in town that are helping out with resources. We placed a couple hand washing stations around town. We've got places that are offering food for kids for lunch. We've got the food at the Boys and Girls Club and at Lebanon High. If you go to my page, Lebanon Mayor Paul Aziz, on Facebook, there's a ton of these resources that I've been posting. City's been posting them. Boys and Girls Club, Lebanon High School, those are places that are helping out those folks that need that. Lebanon Soup Kitchen, that's one of our resources for the folks that are having difficulties, need food. And I spoke to Randy Peterson, the manager, yesterday, and they provided 97 meals served last night. 97. Normally at the first of the month it's lower because people get their money and they're able to go out and get their groceries and actually have some food. So the attendance is a little bit lower, and then it bumps up a little bit towards the end of the month when people are getting more strapped by the end of the month. However, normally it's 60 people are usually around the first of the month, and they did 97 meals. They gave out 70 plus loaves of bread and 80 to-go meals. So not only are they providing a meal there, they are giving food and sustenance for them to go out for another couple meals, two meals, and they've been very helpful. Big kudos to the soup kitchen. Randy, you guys are doing a great job. All the volunteers, thank you all for what you're doing out there and helping folks. I spoke to Marty Cahill, the CEO of Samaritan Lebanon, and I wanted to get just kind of an update on what's going on there. He said the hospital is prepared as they can be. There's only so much preparation they could do for something like this because there's a lot of unknowns. They do have adequate PPE for the moment, and as you know, as you've seen and read, this changes minute by minute. I've been on conference call with the governor, with other mayors, and by the end of the call, the governor had to leave and came back with completely different information than what we were told in the beginning because the president said something different. So this is just constantly changing, and I think that's probably lending itself to a lot of the stress, the unknown. I mean, we hate that. It's just something. I like my routine, and I know Mary does too. And we like our routines, and our routines are all screwed up. Everybody's, and it's uncomfortable, and it can be stressful at times. And I'm with you on that. But we'll get through this. We're going to get through it. We've got great resources. We've got people that are actually listening to what we're saying about not going out, about staying home as much as possible. Lots of humor on the internet, which is great because sometimes you got to have a little dark humor to get through these tough times. Being an ex-cop, that's the way we got through bad calls, and you just use that humor sometimes. So I'm not condoning dark humor. However, if you use it, if it helps you, that's great. So back to Samaritan, they do have adequate PPE for the moment. Social distancing, they're saying it's super important. They're stressing that, just like everyone else is, that they feel that that's helping. If you do not feel good, and this is going to be controversial for some people, if you do not feel good, you will not be tested. If you just kind of feel cruddy or you think you've got some symptoms, you won't be tested. If you watch last night's No BS MD, it was amazing what they were talking about, and it really is. If you get tested and find out that you had COVID-19, what's going to be different? You should still be quarantining. You should act like you have the virus, and you should act like other people have the virus. So both ways, and then that keeps you away from everybody as far as spreading the germs. That's really the biggest problem is people want to be tested. There's not enough test kits, and those test kits really need to be reserved for the frontline workers, for the paramedics, police, the nurses, the doctors, those people that are in there dealing with people that have it or possibly have it. Mm-hmm. So getting a test and you find out, oh God, I've got COVID-19. Yeah, take 2 weeks off, be at home like you were with the flu, and get through it, unless you're a really high-risk person. Then, if you're a high-risk person and you have it, and you start developing the really bad symptoms like the breath, the shallow breathing, chest pains, anything related to your chronic maybe issues that you have, COPD or anything like that, anything, if it starts getting really bad and hard to breathe, you got a high temperature, then contact the urgent care or the ER by phone and then have them evaluate you. They'll ask you the right questions. But again, unless it's a need for you to come in and get tested, and they're only going to test you right now if you're being admitted to the hospital. That's basically it. So they know whether you have it or whether you don't. Right now, Samaritan does not have anyone in the hospital that is tested positive for COVID. And I think part of that is because of their precautions. And I was over there the other day, and it's amazing. It's like a ghost town, but I just want to say that they're doing everything the right way. Stay at home. This is, again, from the CEO at Samaritan. Stay at home and contact urgent care or ER if the symptoms get really, really bad. But again, there's no cure for this. There's no secret pill that you can take. And I know there's trials out there and you hear this stuff being thrown back and forth, but again, you listen to the No BS MD and you'll hear there's just nothing they're going to be able to do. So the fact that you know you have it, what's that going to make you stay home harder or more? It's not going to do anything. So just stay home in the first place and don't worry about the testing. The testing comes if you're a person at risk. You know, you've got your grandma that's 80 years old. She's having trouble breathing. She's got a really high temperature, over 100, maybe 102. Those are the kinds of things. Contact urgent care or the ER, and they will then direct you. They still have the drive-up testing, but generally you're going to get admitted to the hospital, and then they're going to take the test just to verify so they know how to treat you. Okay, switching gears just a little bit, the Veterans Home. I spoke to Valerie, the Director of Nursing, today over at the Veterans Home, and as many of you know, we've lost our second hero early this week, and it was really sad. And we had, 4 weeks ago, 16 positives at the home. 2 have passed away, and at this moment, all but one, have recovered, and 1 is not in super bad condition at this point. So we have 1 person left. The rest have recovered. You may have saw the video, the World War II vet that got through it. He's fine. He had his little birthday party the other day. It was awesome to see. The other thing is, of the staff, 10 positive out of 260 staff. 5 have recovered completely. So we have 5 basically that have the COVID right now, and they're obviously not in the facility. I think they've done a great job. There's been no new cases in the last week or two. there, except I think the one that was internal, one of the residents, and they retested him and found that. But he's in that list also. So they're getting a lot of community support. They're very, very happy with that. It's making the residents feel good. They've got a station, kind of like an in-house cable station, and they're just constantly playing all the videos. I've done one. They're coming from all over the country, world actually, and they're just giving messages of encouragement and support, family members. It's pretty awesome, and they're really, really pleased with the community outpouring. They do need masks at the Veterans Home, so if you're making the masks, you can contact the Veterans Home. And the masks aren't to prevent anything. What they are is for the people who have recovered, for the people who are just kind of in their rooms. It's just a safety precaution for them. So we know that those masks are not the ones that are going to prevent you from getting it, but it's just a little safeguard for them. So they are looking for some masks, and they're still waiting on masks from the state, which is a little frustrating. And I know I've talked to several state representatives and authorities, and I don't know where it's at. We're just waiting. I know the county just received a large shipment today. I saw the sheriffs had dropped off at the Lynn County Health Authority, so I'm hoping that they're going to get some of those masks that came in. The residents are still sequestered to their rooms, and that's the hardest part. They have no visitors. They're not allowed to eat in the dining room. Each resident is in their own, and the nurses and the staff go into each room individually, come out. They have to redress to the next room they go into so they don't take something that might be in one room and infect another room. That is why they're burning through so much of the personal protective equipment. It's a difficult job, and my hat's off to those nurses and caregivers there at the Veterans Home. They're just doing a fantastic job, and we appreciate everything they're doing for the community. They're doing quarantining longer than the CDC recommends, just because of the fragility of the people that are in there, their ages and their conditions. You've got some people at high risk in the Veterans Home, many of the veterans. So we want to make sure that they're taken care of, and they're doing it by being just a little bit longer on their quarantine period. Next page. Oh, actually, that was pretty much it. Oh, sounds like somebody's calling for computer repair. I guess we're kind of closed. Okay, let's see. So now I'm going to go into questions that people have asked. These will be things that people have asked us over time in the last couple of weeks. And so some of the stuff might be a little bit old. Excuse me, seasonal allergies. So some of these questions are really helpful. I thought it would be good to share those, and then at the end it might already answer what you want to ask. And probably about another 5 or 10 minutes, and then we'll answer questions that we've got on there. The question is, I have things or services to donate. How can I find out what is needed? We created a site that's www.lebanon.recovers.org, lebanonrecovers.org. And it's a website. You can use it on your phone. It's a lot better on the computer if you get in there. Navigating on the phone's a little wonky, but if you get on the computer, it works really, really well. There's people in there that offer, people that are asking for, like, I'm out of Tylenol, can somebody help me? I need meals, things like that. So you can go on there and you can offer things and help and services, or you can actually request for those things. It's a great website, and it's kind of a way to bring everybody together. So it's LebanonRecovers.org. Do I need paperwork to drive to work? This one kind of shocked me, but then I realized I've heard that there are some businesses and doctors and different people that are actually giving them notes saying it's okay for them to be out. You don't need a note to drive. Basically, the cops aren't going to stop you because you're driving to work and suspicious that you're out doing something nefarious, unless you are, and then you're going to get stopped. So, but yeah, you don't need any kind of paperwork. There's people that are essential that are working. And then I want to look at the other side of things. I've gotten some complaints that I don't think people are following the guidelines. I see too much traffic out there. That's not our job to monitor that. We can only put this information out and hope that people are doing the right thing. From the looks of town, when I've been out, it's pretty dead out there. There is traffic, But we've got trucks going through that are supplying the markets and the restaurants. There's going to be some commerce going. But I live off of Williams here, and that's a truck route. And I guarantee you the traffic is way down from what it was. And I'm not seeing the kind of traffic or hearing the traffic that I used to hear. Can I walk my dog on one of the trails? I covered this a little bit earlier, but I want to mention it again. If you're out and about, we are not going to arrest you. We are not going to stop you if you decide to take a little walk on a trail that's near your house and you want to take your dog. What we wanted to stop was people all driving to a specific spot, let's use Cheetah Lake as an example, and filling the parking lot with cars overflowing out to the street. That is what we don't want. So that is one of the reasons we closed the trailheads. It's not so much we don't want you to get out there and exercise, it's we don't want people near each other, and we want to encourage the social distancing. So it's up to you what you do, but like I said, you're not going to be arrested for walking down the street, getting some exercise, taking your dog out for a walk. It's just keep your social distancing and don't congregate in groups. It's not difficult at all. But I just want to make sure that the police aren't out looking for the stuff. The police state hasn't taken over. We're not in martial law. We're trying to do the things that we can do to keep you safe, and me. We all want to be safe. Can my caregiver or nurse come to my house? Absolutely, absolutely. Especially if you've got a caregiver or a nurse, there's obviously a need for that, and they're absolutely essential employees. I highly recommend if you have someone come into your house that is a caregiver, that they wear a mask and gloves, and that they have all the proper procedures that they do. You don't want someone coming in your house without a mask on and without the gloves and the proper equipment. So, but yes, they can be out and going to their job. This one person that was kind of interesting said, I'm seeing chiropractor ads a lot on Facebook, and they're advertising that they're open right now. Is that okay? Can they be open? Well, a chiropractor can be open if they're doing things that are medically necessary. So if someone just kind of doesn't feel that great and they just want to get a little back adjustment, they shouldn't be open if that's all they're doing. But if they're doing medically approved, they've had X-rays and they know that they have to do this and they're on a kind of a program, sure they can be open. But yeah, again, it's not something we're going to go out and enforce. That would be something more from the state level that they would enforce that. But in general, a chiropractor is hands-on, and that's one of the things that we don't want is hands-on businesses unless it's medically necessary. I've had a daycare out of my home for years. My numbers are very low, and all health worker kids right now. Is it okay to continue? So this person has daycare. Their population of their daycare has dwindled. They only have a few kids. However, the kids they have are critical people. They're people that are working in healthcare, and that is absolutely okay. That is fine. There's an exception for healthcare, and especially, or an exception for childcare, and especially for people who are on the front lines. So that is fine. You can check with the state more for very specifics on how many people and those kinds of things. I'm not versed in that, but it is allowable. Let's see. I need to dump my RV tank. What do I do since River Park is closed? If you missed it in the beginning, there's resources on the website. If you click on our website, Lebanonoregon.gov, you go up to the top. It says COVID-19. There's actually a list of press releases, and one of the first ones is the RV dump sites and where you can get things done in Lynn County. I'm going to take a little sip of water here. Excuse me. Kind of going on. Okay. I have a small lawn care company. It's just myself. Can I continue? Now I choked on my water. It's not a dry cough, I promise. I tried to talk and drink. It does not work. Yes, you can continue. The lawn care business is a very low-touch business, really not doing much at all. We have a lawn care company here in town that they come, they send us a text message saying they're going to be here today. They did it just today, in fact. They come, they do the lawn mowing, they're gone. We go online and just pay them online through their website. It's an awesome service, and they can work all day long. So, and they're a family business, so it's great. Okay, so now at this point, that's about the end of my questions, and I've talked long enough, and you hear me blah, blah, blah. Now it's your turn. we'll try and field some questions and see what we got. Apparently, Mary's not able to see the
I can't
questions.
see the questions.
Ah, that's weird. Okay. Well, let's see here. I'm gonna move my little stick here. And I see Victoria says the traffic has gone down significantly. And I know, Victoria, you're on a pretty busy street, and plus you work over this direction. So I know that, yeah, you're correct. Glenn, thank you. You're welcome. You're absolutely welcome. Hey, Sean. See Sean Alley out there.
Oh, what do we do for
Isabella,
haircuts?
oh, Mary's granddaughter. Oh, oh. Says Isabel says hi.
She says what to do about haircuts.
Ah, haircuts. I hate to say it. It's time to get out the clippers and the scissors and start doing it yourself as much as you can. You know, I don't have too much up there to do, but yeah, it's going to be rough. Thankfully, I got mine cut right before this all happened, and it's going to be tough. I've seen even a couple of the people who own beauty shops in town, you know, showing that they're going to be growing out. They're gray, and there's just not a lot we can do. Again, that's technically not essential. So here, let you look up there.
Well, just so you know, I did cut my own hair. I was desperate. It was in my eyes. But, you know, just be careful and do it very gently. Do a little bit at a time. And if you do get out of control with it, it grows back. And you're stuck at home anyway. So they're the only ones that have to look at you. I did pretty good, though, don't you think?
I think it looks very nice, actually.
Yeah.
Of course, we are together 24/7, so it looks really good. Yeah.
I had better.
So, yeah, and I'm sure my friends that have salons in town probably freaking out right now, but it's just one of those things that we have to do. That's such a personal contact business. That's one of the problems.
Senior Center has assistants
Hi,
helping
Dina.
picking up prescriptions.
Oh, yeah, and you know what? That's weird. I had that on my list. Thank you. I think that was Dayla that mentioned that. Where was that? That was under the police department. I forgot that. Yeah, and that was the first bullet on my police, and I've forgotten. I'm sorry. The police have partnered with the senior center and to do grocery and prescription pickups for those people who are at risk, who can't get out, for the elderly population, and they're working with the senior center for that. So that's great. I'm really happy with what they're doing. The calls are down a little bit, so they have some time to help people out, and I think that's great. The problem is, one of the interesting things on the police department is the changes that they're going through. You know, I handled calls back in the 80s, and I know, I'm an old guy. But when I was a cop, you know, we handled calls, and there's a lot of interaction. There's a lot of personal contact. You're arresting people. You're shaking hands. And now, community policing's around. We didn't have that back in the 80s. And community policing is, you know, cops hugging kids and, you know, going to events and shaking hands, and they can't do that anymore. And when they do show up, you might see them with a mask or you might see them with gloves. So it could be a little more scary for kids, but it's important for their safety so they can go home and be safe.
What do you do as mayor on a regular basis, daily?
Is that what it is?
There was one up there.
Okay. Somebody said, what do I do as mayor on a regular basis? Generally, it really just depends. Usually I'm in contact with the city manager once a day. We communicate back and forth what's going on. We work on upcoming economic development projects. We talk about things that are happening in the city. You know, when the water treatment plant was going, there was a lot of discussion on that. It's just a lot of general things. This last 3 weeks has probably been the busiest I have ever been as mayor. In 7 years. I have been on the phone constantly. I have been talking to people. I've been emailing. I've been posting on social media. So it's become a busy job. And the interesting thing is, just a little note, you know, I never thought something like this would happen when I ran for mayor in the beginning, and I never really thought about it until just recently. And I always worried about the big earthquake or a horrible shooting or something really bad. And preparing for that and making sure that, you know, our disaster plans are ready and things like that. But the pandemic has always kind of been on the back burner for everybody, federal government all the way down to local. And it's just something that's been talked about. The problem is it's not sexy. And what are politics? Politics are all about sexy stuff. And when I'm saying sexy, I'm talking about oh, yeah, let's get that $5 billion bridge built going from Lebanon to Brownsville or whatever it is. And then they bring that back to their community and show that as a big win, and that's sexy. However, going in there and saying, you know, we need 1 million masks in a reserve just in case something really bad happens. Who cares? Who cares? Well, now we do care, and I hope the broken machine in Washington, Democrats, Republicans, I hope they get together and that they really see that this is critical. If they don't, we got to vote them out. I don't care what side. This has been going on for years. This has been going on way back since Clinton. The stockpile has not been enough. They keep putting it off. They keep kicking the can down the road, and so that's just my personal feeling on that.
We had some more questions about
Okay.
the farmer's market, so
Okay.
they must have missed that part.
What were the questions?
Just is there going to
Oh.
be a farmer's market?
Oh yes,
Yeah.
there's going to be a farmers market. At this point, we're working on the details of the community development department, and one of the details will be that it'll be probably like a drive-through. But the biggest thing is it has to be able to conform to social distancing, making sure that each booth is far enough away. If we do a drive-through, it's probably not going to be able to be at the Grant Street location. It's probably going to be a little bit too small. So that will have to be figured out. Those details will be up to the people from the market. Thank you. Lost my train of thought. The people from the market will have to decide those details, but they're working with us. The biggest thing is there won't be any non-food items. There won't be any entertainment. There wouldn't be anything to try and bring people just to come and have an ice cream and enjoy it. But it would be more of we want to provide a service so that people can get their fresh fruits and vegetables. I know Mary and I just love getting fresh fruits and vegetables that time of the year. So we definitely want to keep that up if we can.
Is there an ongoing plan for the schools?
I don't know that. So far at this point, it looks like it's homeschooling, distance learning kind of a thing. Everything I'm seeing and hearing from the governor's office, everywhere, I've got a feeling the school year's probably going to be canceled. I don't know that for a fact, but I've got a feeling that the way things are going, this is probably going to last another month at least. And I know that's not what you want to hear, but that's the reality of it, because it's just doing it for 2 weeks doesn't fix anything at all. It's about a month at least, and then by that month time, we're going to start seeing that's supposed to be the peak time, that we would cut that curve down. I believe it's middle. I think now they're starting to adjust it to the end of April, that curve time is coming. The good thing is Oregon hospitals are not overwhelmed at this point. We have beds. You look at New York, you look at that nurse from Maryland, it's pretty ugly on that state, but on that side of the country. But we've taken action quickly, and everybody's participating, and I think it's making a difference. So we'll see.
Okay. They wanted to know if there's a way for the citizens to make comments in council meetings now, since you're doing those over the web.
Yes, it's not going to be perfect. We're still working on it. We're going to have a Zoom meeting, and the city council will be on that. You can watch on YouTube, so it'll be on live and streamed on our YouTube, and it'll be recorded there. But to make comments, what you do, if you look at the agenda, you go to our city website at Lebanonoregon.org. Go to the new website. Well, it's not really a new website, but it's a new address.
.gov.
.gov. I'm sorry, I said .org.
Yeah.
Yeah, .org. It's new, so I'm getting used to it. Anyways, you can go to the website, go to the agenda, and there's some information on there on how you can participate. Basically, you put your name and information in ahead of time. There's a number you call on the Zoom meeting, and then you'll be able to talk when the appropriate time comes, just like we have at the regular meeting. So there will be time, because we do want to hear from the community, and it's an important part of our interaction and our transparency is that you're able to discuss things. Now, what's interesting is, and a lot of people don't know this, is that the Oregon state law does not require cities to have public comments. The only thing that's required is that we have a meeting that you can attend or see and be aware of. There's nothing that says that we have to have comments. This is something that most cities do. It's something that we do, and I would never want to not do, is to have public comments, and we're trying to work on it as best we can. It might be a little clunky next week. Wednesday night's our meeting next week. But we don't have a super large agenda, so we're going to get through things. allow comments. You can also provide written comments. You can email them, and if you go in and email them to the city clerk at the Lebanon Oregon.gov address. And you can look on the website and find the city clerk there. It's under, if you go to city council, the clerk is listed right on there.
So Brock Byers has asked a couple of times now about some more information about the homeless, parking on properties and things like that. I'm not sure. I think he might have missed the part you talked about the homeless.
Oh, okay. Well, for the homeless, the police have kits, hygiene kits, hand sanitizer, toothbrush, wipes, resource list. There's some hand washing stations around town. As far as parking, it's going to be up to the local, like Walmart or whatever the businesses are, whether they can park there and camp or stay there. So it's really not anything that we're going to say no to or yes to. It's really going to be something the people in private property, if they're allowing that, then that's great.
So can the banks open back up again if they have like a guard at the door to prevent too many people from coming in? Or?
No, because of the handling of checks and money. Again, it's one of those personal contact things. Even with your drive-up teller, I know Mary, I'm really proud of her. You know, she's got her little sanitizer and she gets her card out, gives it to someone, gets it back, she sanitizes it. So that's one of those things that you have to do, is just be careful. But I don't see that happening walking on banks yet.
What about essential workers like Republic Services drivers and officers needing restrooms and parks, etc.?
There's really not an answer for that. The problem is those are places where people are going to congregate and go, and it is difficult. And again, being a former officer, I know that's difficult. Hopefully they can get to a restaurant or a place that will allow them to use the restrooms. I think I heard Starbucks is allowing the officers. I know they're doing the nurses for sure, allowing them to come in and use the restroom. So it's kind of one of those community things, is we need to have places where people can do that. But again, you go into a public restroom, you go into anywhere, it's got to be maintained 24/7. It's got to be cleaned every time someone comes out of there. It's literally a nightmare and a staffing issue too.
That's all that I caught. I think there might be more questions because it was rolling through pretty quick, so I was trying to get them all. A lot of them were really just thanking you for such good, important information.
Thank you, everybody. Jennifer mentioned she saw a washing station set up at the bus stop at Park Street. We just moved that today there because that's where a lot of people congregate to get onto that bus that have no other transportation, and that's their only way to get around the Lynn shuttle. So they are still taking passengers. They're social distancing, but that's the reason we put that up there, because that's an area where people will be and need to use that.
Is there a day center for testing homeless?
No, there is not. Like on the earlier part of the video, I talked about, if you are showing extreme symptoms, shortness of breath, to the point where you need to go into the ER, you get into the ER, they're gonna take you in intake, and then they will test you. You will not get a test if you don't feel good. Homeless, cop, anything. It just doesn't matter. You're not going to get tested. However, an officer that goes into a scene where he feels that he might have been exposed, then that might be something we can do. The problem with the testing is, if you just got infected, it's kind of like a pregnancy test. You just got infected yesterday, you think you might have gotten it. It's not going to show up for a while in your system. So right away, in 2-3 days, you take a pregnancy test. It's really not going to be that accurate. And it's the same thing with this. It's not going to be accurate for quite some time. The key to this is most people are going to get over it like the flu. Most people, not everyone. It's that vulnerable population that is at risk, and that's what we're trying to stop, is that they don't get it.
How can homeless folks keep themselves safe from COVID? They can't stay at home if they don't have one.
It's really difficult to say, and I don't know what the answer is to that. We don't have facilities. We don't have a way to house people. And honestly, housing people without sanitation and without proper staffing, it's impossible. The soup kitchen is the closest thing that we have that people can go in, get some food, and then take care of their business later.
Yeah, it's just been several homeless questions. There's not really an answer to that. They're gonna have to be social distancing is what
yeah.
they're gonna have to do.
Yeah, and once you create a hospital-like environment with a bunch of beds, you've got so much dangerous times where people are going to be able to be exposed, transmit stuff back and forth. I don't care if the beds are 10 feet apart, you still have that ability because it's in that facility. And one of the things that I heard last night on the No BS MD that I thought was really good is they still haven't, and I've been watching this closely, they still cannot say it is not airborne. They're saying that it's airborne because you spit out, there's a lot of different things. But that case up in Washington, if you hadn't heard about that, where they had a huge amount of people that went to this choir practice, and 40, I think it was 60, and then 45 of them came back with the virus. And they were all practiced social distancing at the choir practice. This is the kind of thing that is spreading the virus. I don't care if they're social distancing. You've got 60 people together, there's a chance that you could transmit something.
And Dela says that they have masks for homeless too, so that would help.
Oh, okay. Dela said that they've got masks for the homeless from the police department. So they've been doing that. And again, the kits that we've got, the hygiene kits, say hand sanitizer, toothbrush, wipes, resource list. We're trying to get those out to the folks that are homeless too. And I know the officers in the field that contact people that might be homeless are trying to give them the resources.
Hope everyone's safe. Thank you, thank you. What about unused hotel rooms for the homeless people?
I don't understand why we would put people that are healthy in hotel rooms. If we get a huge amount of people that are sick and they're homeless, then we'll have to look at some kind of facility, and it might even be a tent behind the hospital. I don't know what that is. But at this point, there's no reason to do that because you don't want to put people in a facility when they're outside more, and now they're in an enclosed facility where there's other people that could contract it. So it's a difficult thing, but it's not something at this point that we are interested in doing from the city standpoint. If the hotel wants to offer that, that's fine. Is that about it? I've had tons of scrap. Okay, so I got some people making the masks. That's great. If you missed it in the beginning, Samaritan is looking for masks. I'm sorry, the Veterans Home, not Samaritan, but the Veterans Home is looking for the homemade masks, and they're using it for their patients maybe after they've recovered. It's just kind of a small personal protection. They know that it's not going to keep them completely safe, but it's at least a nice thing to wear that they can at least not be spitting out the germs and getting them.
Has there been any problem with food supply coming in?
No, there has not been at all, and basically the biggest problem has been people hoarding. That's really been the biggest problem. The store lines, people kind of panicked and everybody went in. From what I've heard and what I've seen is that it's getting better. I know our local restaurants have really, really stepped up. We've got takeout. Yeah, I've eaten a few of those. We had a few good meals.
We
on
call
the
it
takeout.
gaining our COVID-19 pounds.
Yeah, pretty much gaining our COVID-19. But yeah, no food shortages as far as I know. Not in the facilities, not within the community that I'm aware of. And again, Soup Kitchen has been handing out food, and they get a meal, and then they end up taking home about 2 or 3 meals, really.
How many COVID positives at the hospital?
There's no COVID positives at the hospital. And you can go back and watch the beginning of this. I talked about the Veterans Home, how many people have it, and all but one veteran have recovered from COVID, and there's just one that's dealing with it now. So that's exciting news. And there's been no new cases this week at all in the Veterans Home.
Denise says that the River Center still has some food banking on Fridays, drive-through.
Oh, okay. River Center drive-through food banking. I also saw, the pantry one, the one that the church that's over there.
Oh, the fish?
The fish.
Fish.
I think also has their weekly food.
Just Corvallis Sewing Brigade offering more
Corvallis Sewing,
masks
good.
and stuff. So
Thank you, everybody. Well, I'm going to keep continuing to update my page. It's a lot of information, but what I'm trying to put on there is the stuff that really applies to us locally and the things that are important. Sometimes it may seem like a lot. I'm trying to post 5 to 10 things, not much more than that, because I don't want to overwhelm you. But if you haven't, you can click like, or if you don't want to like my page, you can just follow it, and then that way you'll get these updates. And you can even go in, and after you do the follow, you can say show these first, so that way you'll get the COVID-19 kind of updates right away. And I think it's a good way to communicate. I'm going to take this video, I'm going to put it, I've got another camera that's filming it, and we're going to put it on YouTube, and that way it'll be closed caption for our hearing impaired friends, because I know that you cannot see that on Facebook, and there's a lot of important information that we need to get to everybody here. Okay, so a lot of thank yous. So kind of in closing here, I had a little thing here at the end. You know, we're a strong community. We've been through a lot in the past. This is new. It's a little crazy at times, and it's stressful, and I understand that. But we will get through this. It's going to be tough at times, but I think the toughness will come out the other side stronger, more aware of our hygiene and the viruses and the things that can happen. Maybe the way we're doing this, it's going to help people be a little bit better when flu season comes around. I'm not really sure, but I just want to thank everybody in Lebanon for your continued support. The city council, the city manager, Ron Whitlatch, just have been doing a great job. Like I said, I'm in communications with Ron a couple times a day at least, just talking about the current issues, what ifs, what about this, what about that, and asking those questions you ask me to them to see what we can do. So I just appreciate your cooperation staying home. I ask that you continue to do so. Realistically, I think we're looking at the end of April at least for this, and even at the end of April, I don't know how drastically it's going to change. It really depends on the president, the governor, kind of how they decide they want to do things, and we just don't know at this point. And again, it changes daily. So the good thing is, the positive thing is, it looks like we're doing pretty good. There's no new cases in Linn County today. That's not bad, and we're doing pretty good on the recovery rate too. We have had a couple deaths. It's horrible. I don't want to see any more. And by social distancing, we can. Stay safe. Help us by staying home as much as you can. If you've got needs, get out and get your stuff done and get home. If you're going shopping, please don't take the family. Please don't go husband and wife shopping. Take one person and go. The less contact you have, the less people you have there, the better it's going to be. You know, I'm hearing couples going shopping together or families and stuff. You know, if you got childcare issues, I know that's difficult, but I've even seen it on the page that I mentioned earlier about the LebanonRecovers.org, where people offered to do childcare if they needed groceries, or they would go pick up groceries for you. So there's a lot of help out there. Lebanon.recovers.org is a great resource. You can put your needs on there, and you can also offer your help to others. So thanks. We're going to get through this. Thank you to my assistant,
Stay
Mary, with her new haircut.
Yeah, my new haircut.
Just don't tell Melissa.
She already knows.
And we'll get through this, and post your post when you're talking about positive stuff for Lebanon. Post that hashtag Lebanon Strong, because that's who we are, and those are the people that we are. Thanks again. Have a great night, and I'll probably do this maybe next week and just see how it's going. And I won't be doing a daily update every single day on my page, but I'm going to still be posting information all the time. So take care. Be safe. God bless.